Hi, I'm Dr. Okojie, a board-certified naturopathic physician and hormone expert. And today we're going to talk about the things that you must do before starting TRT. Number one, don't chase the number. Bigger isn't always better. More T isn't always better. In fact, sometimes we see guys who have testosterone levels in the middle of the range get up to the higher end of the range and they actually feel worse. Sometimes high T can lead to symptoms that people can mistake for low T. You can have irritability, you can have hot flashes, night sweats, you can have erectile dysfunction, and you can actually have decreased libido if your testosterone levels are too high. So don't chase the number and pay attention to your symptoms. And that leads us into point number two, paying attention to your symptoms. Just because you have a level of T that's not at the high end doesn't necessarily mean you need TRT. Check in with yourself. If you're sleeping well, if you have good motivation, if you're working out and seeing the results that you want, if you have a strong libido and you're not suffering from erectile dysfunction, then it's totally okay to have a testosterone level of 500. Not everybody is the same. So don't get on T just because you want to have a higher number. That doesn't necessarily mean you're going to be healthier. Number three, it's okay to compare to yourself, but not to others. Don't compare yourself to other people who are on TRT. TRT is getting wildly popular. Guys are paying more and more attention to their sex hormones and they're telling people and spreading the word, which is great. But it's important not to compare yourself to other people who are on therapy. People start TRT at different times in their life. Their receptor sensitivity is different. They may have a different symptom profile. So just because your buddy is looking good at a certain T dose, that doesn't necessarily mean it's good for you. But you should compare yourself to yourself. The whole reason for starting TRT is to get healthier and to feel better. So compare yourself to how you felt before you started treatment, and that will help to determine if it's working. Number four, be patient. TRT is a great way to improve your health. It can improve symptoms of poor libido, erectile dysfunction, fatigue, insomnia, depression, anxiety. It can help you to achieve that ideal body composition when you go to the gym, and just overall increase your mojo. But the results take time. Also, TRT is an ongoing treatment, which means you need to remain on it consistently to maintain the results. Number five, see a professional. There are tons of TRT clinics popping up all over the place. Online clinics, mail-in clinics, they're testing your blood, your urine, they're taking a whole tube of blood, they're taking a drop of blood. Make sure you vet the clinic that you go to. Do your homework. Ask around, read reviews, and make sure the clinic that you go to is credible. Also, don't get testosterone from your gym buddy. Yes, he's jacked and he's ripped and he can bench press 1,000 pounds, but he's not a doctor. He's not a medical professional. If you're getting your testosterone prescription from the locker room at a local gym, you likely have no idea what you're putting in your body. So be smart.